Hello everyone. I wish to express my appreciation to the American Association of Public Health Dentistry for this great honor. I regret not being in Kansas City to accept this award in person and appreciate the chance to share a few thoughts with you anyway. This recognition is particularly meaningful to me given that my first attendance at a national oral health conference was in May 1998, a time that marked a major change in my career. The transition from patient care to public health and health policy, and then eventually dental education. In 1998, I was still director of the craniofacial program at Children's Hospital in Seattle, a position which exposed me to the impact of oral health on children's overall health, also to health disparities, especially in oral health, and finally to the lack of oral health knowledge in the medical community. The month before that 1998 National Oral Health Conference, I had chaired a conference at the UW called Children Our Future, Ethics, Health Policy, and Medical and Dental Care for Children. Representatives from DHHS at this event included Dushanka Kleinman, Bill Moss, John Rossetti, Don Schneider, and Caswell Evans. The conference was well received, and the idea of a similar event for a national audience was entertained. A few weeks later, I was introduced to Hal Slavkin, then director of NIDCR, to discuss this possibility. And eventually, this became the 2000 Face of the Child Conference. But on a personal level, spring 1998 was a very challenging time for me. 9 months earlier, I had been diagnosed with progressive sclerosing cholangitis, an autoimmune disease that leads to liver failure. And while the craniofacial clinic was running very well, my new division chief had just made it clear that he was not supportive of my continuing to work in oral health. Things were not looking good. But the National Oral Health Conference was life-changing for me. I loved the people in the dental public health community, your community. I was struck by your enthusiasm and energy, and interest in the UW conference. I, a physician, nevertheless felt genuinely welcomed by you. I clearly recall thinking at the time, this is a sign. And if I had not been introduced to key members of the dental public health community at this critical juncture in my life, it's unlikely I would have continued to work in oral health. After the Surgeon General's Conference, I returned to the UW to work at the interface of medicine and dentistry. We have so much to learn from each other. I began to work in the dental school on oral health education activities for medical trainees. I also worked on the medical side with the medical school and with the American Academy of Pediatrics, and later the Association of American Medical Colleges. I was invited by the late Larry Meskin and Dom DePaula to join the Santa Fe group, whose mentorship was invaluable for me in my continued work in oral health. When Martha Summerman, who may be there, hi Martha, became dean of the UW School of Dentistry, she asked me to develop a regional education track for dental students to address workforce issues in rural areas in the Northwest. The RIDE program, as it's now known, has integrated dental hygiene, and medical students in many educational activities. In 2010, I then had the chance to return to the federal government on a cooperative agreement to work as a special advisor on oral health and primary care at HRSA, an opportunity to watch firsthand how health care reform was taking shape, and again, to call attention to the importance of oral health for overall health. When Joel Berg became dean of the UW School of Dentistry in 2012, he charged me with working as Associate Dean for Academic Affairs to help create a vision for the dentist of the future that includes interprofessional practice. If you had told me back in 1998 what would be the eventual course of my career, I don't think I would have believed it. But as things turned out, I've had wonderful opportunities to meld my interests in medicine, dentistry, and public health. I'm especially grateful to all those named above who provided me with mentorship and opportunities. I also acknowledge the mentorship of Sam Dworkin, David Nash, and the many others with whom I share a unified vision for health that includes oral health. I thank my current dean, past deans, and fellow faculty at the UW School of Dentistry. I thank the federal agencies and private entities that believed in and supported this work, especially NIDCR, HRSA, the Washington Dental Service and Foundation. And finally, I thank my family for all their support and my first great mentor, Henry Meridian, my dad, a dentist and a tireless advocate. Thank you very much for this honor, and thank you for the chance to speak with you for a few minutes.